A lot of people feel like healthcare has gotten harder to access, harder to afford, harder to understand. You go to your doctor and they seem rushed. You try to get care and it takes longer. You look at a bill and it doesn't make sense. And most people assume that there's just how this, wonders how the system works. But what if, that's not the full story? What if your provider is under more pressure than ever, and that pressure is directly affecting your experience as a patient? Now, today's guest is Reid Zeising. He is the CEO of Gain Servicing, a company focused on improving how healthcare providers, law firms, and systems work together to ensure access to care. His work sits at the intersection of healthcare, finance, and technology, and it gives him a unique view of what's really happening behind the scenes. Now, this conversation it's about stress, it's about access, it's about money, and it's about the future of healthcare and what it really means for you. Now, I am so glad you're on the show, Reid, today. I just like to welcome you to the show. Reid is going to be coming on more often. He has his own podcast series here, and he's going to be part of our podcast community. And I'm just honored to have you here today.
Thanks, Stacey. I appreciate being here.
Oh, you're very welcome. Now, I just want to start with what people are feeling. A lot of patients feel like healthcare has gotten harder, harder to access, harder to navigate. It's become more stressful. From your perspective, what actually is happening?
I just want to acknowledge first, like, patient experience is just very unfortunate, right? And that is, if you're insured, not all insurance is the same, not all pricing is the same, not all deductibles are the same. And there's a real anxiety that I feel as a patient, right?
Hmm.
You
Yeah,
go in, a doctor recommends something, and you're not sure if it's going to be covered or approved. There's a denial. If there's a denial, there's an appeal process, but that in and of itself feels overwhelming.
it really
And then
does.
you've got, as I mentioned, large deductibles to satisfy. I mean, it's really, I just want to acknowledge that before talking about, what I also believe is a tremendous amount of stress being put on the doctors and the medical community.
Yeah. Why does it feel like both patients and providers are more stressed at the same time?
From the patient side, you've got premiums continuing to rise, right? We've got record profits for healthcare insurance companies. And we've got continuing decline in reimbursements for doctors. So
Yeah.
that's very frustrating from both a doctor's perspective and a patient's perspective. From the patient's perspective, we look at the public filings and see these record profits and think, those are my premium dollars.
Yeah.
Why am I being denied anything that
Yeah.
a doctor says I need? And from the doctor's perspective, now there are a multitude of CPT codes, which are the reimbursement codes that doctors get paid from. But overall, those reimbursements have been declining. They've
Yes.
been declining from commercial payers. They've been declining also from government payers.
Hmm.
And the one thing to really mention is the government systems where in Medicare and Medicaid, I mean, Medicaid reimbursements in general lose doctors money. They are not being paid profitably to see those patients. So
Right.
that puts additional stress
Yeah.
on the doctor's offices to make that up somewhere
Right.
through getting more efficient, through being better at delivering care, but also from finding other reimbursement sources that could possibly make up for some of it.
Right. Oh, it's so true. It's so true. One thing that you said is that your provider is getting squeezed from both sides. Like, can you explain this in simple terms?
Yes. Healthcare insurance contracts with medical groups to reimburse doctors a fixed dollar amount for procedures after completion and submission of those HICFAs or invoices. And what has happened is a tremendous rise in cost of delivering care.
Yeah.
right? Labor costs have risen, real estate costs have risen. You still are going in largely. There is telemedicine, but not for, you're not having your arm operated on. You're not going to see a orthopedist or pain management doctor solely telemedically,
Yeah.
right? So your cost of delivering care for the physician is rising, and your reimbursements, the money's being paid by government, Medicare and Medicaid, and commercial, that's the Uniteds of the world and the Kaisers of the world, et cetera, that
Yeah.
people purchase, are declining. And they're asking doctors to deliver value they call value-based care,
Right.
right? Based on patient outcomes. It's great in theory to think that you will be paid to have your patient healed and cured and so on and so forth. But it's not always. The doctor has to deliver certain care or believes they have to deliver certain care that then insurance companies are dictating as denied. And who should be running this show?
Right.
I still feel that patient-centric care delivered by knowledgeable doctors with patients making final decisions is the thing that we all want. I mean, other than if we're the government that wants to save money or the healthcare insurance companies that want to make more money.
Right. You know, so what does that actually mean for like the patient sitting in the exam room?
It means you've walked in, you're paying a deductible that you've had to research and may vary, and uh, a copay perhaps to begin with, and then a deductible to satisfy before your insurance kicks in. And it means that that gives you a fair amount of uncertainty. You go then to see a doctor. In general, that's a better experience, but that experience is also under stress because healthcare providers are encouraging doctors to see more patients, quote, more efficiently. But
Yep.
what that means is there's a limited number of minutes that that care is trying to be squeezed into. And as a patient walking into that room, that doesn't feel great.
No, it doesn't. I remember when I used to be able to sit down with my doctor and he could talk to me for a half an hour or so, even sometimes longer. Now it's like 15 minutes, if you're lucky, 5,
Yep.
10, 15 minutes max, and they're out of the room,
Right.
ready to see the next patient. And that's very upsetting, especially if you waited in a waiting room for so long, you spent X amount of money on a copay, and you don't know how much you might have to spend more depending on the insurance company you have. And all you get is, 5 or 10 minutes of the doctor's time.
And I think there's some real, if we talk about solutions or things that can be worked on, right?
Hmm.
Or we talk about points that both patients and doctors could benefit from. It is fair that, for example, nurse practitioners are highly qualified and there are many things that they can deliver,
Hmm.
right? So
Yes.
seeing a nurse practitioner, while we may want to, while our ego may say that we want to see that doctor because we believe he or she is the expert, number of nurse practitioners, highly trained, very capable in many things, and you can get better efficiencies, right?
Right.
The doctors in the medical groups have been really, really cornered by large healthcare insurance companies with declining reimbursement rates.
Mhm.
And I just believe that, yes, efficiencies should be gained. Yes, things like nurse practitioners can be utilized. But insurance companies on the other side, let's talk about some possible solutions. With
Right.
over a third of your costs being administrative costs,
Hmm.
right? Not tied to the premiums that go in and the dollars that come out, but tied to that muddiness that's in between,
Yes.
right? Let's force or at least encourage, let's put the spotlight back on the insurance companies to get far more efficient in terms of their own administrative waste so that there are more dollars available for medical providers and for patients. Patients through lower premiums, right? And doctors through increased reimbursements.
Right. How does the provider stress show up in real life for patients?
I feel I am in touch with healthcare providers every single day.
Yeah.
And I absolutely feel for what they're going through because They took a Hippocratic oath. Every doctor that I know in any state that I work in, which is all 50, wants to deliver care in the best interest of the patient. It is why they got into the business of medicine. They did not get in the business to deal with claims denials. They
Yes.
did not get in the business of dealing with the finance department all of the time to see when dollars and when claims are coming in. And that stress I see actively show up on the face and in conversations with doctors almost every day. They are sucked into two areas of the business, HR and finance, that they historically did not have to worry about as much, that are creating tremendous stressors.
At the same time, millions of people are still financially exposed. We're seeing millions of Americans uninsured and even insured patients are delaying care because of the cost. What does the combination, do to the system?
Well, there's two things that happen. One, let's talk about the 27 million Americans today that are uninsured.
Right.
Okay. The uninsured avoid medical care that may or may not be, may be elective and may be necessary.
Yeah.
They avoid it. Number two, when they have kind of catastrophic situations, they either are left in very bad shape or utilize the emergency room systems, which are made available and they are not, charged for. Those bills are largely written off, but it does not account for aftercare and continuing care that they simply can't access beyond whatever they're able to pay in cash.
Right.
In addition, there is a tremendous cost waste, and one of the solutions around this is better utilization of urgent care facilities for uninsured patients.
Hmm.
Because currently they're forced to go to the emergency room. The emergency rooms are necessary. They
Yeah.
are necessary at hospitals for accidents, for catastrophic events, for
Hmm.
people to be seen. They are lifesavers.
Yes.
There are also certain procedures that should, where patients are higher risk and need to be monitored, that should be done in hospitals,
Hmm.
but they should not be used as an urgent care facility. And a large part of that 27 million uninsured patients here or citizens here in the United States are utilizing the emergency room for the care that they need. And it is an incredibly inefficient and high cost way of dealing with a cold or the flu or a scratch or a sore or those things can all be done at urgent care. So there's a tremendous amount of savings that could be had if we had more effective delivery of care for those who are uninsured.
Right.
Number two is they are forced to kind of cash pay. It's another thing that just shines light on the lack of transparency in our current healthcare system. And
Mhm.
I push for transparency at every level in every state. And anytime I'm talking to legislators who are trying to pass bills that they believe are, adding to care, those bills are oftentimes driven by insurance companies that really want to limit care to protect their own interests. And
Right.
what I'm saying is make that more efficient, work on the emergency room system, make stuff available. And
Right.
then there's 100 million Americans in total. It includes the 27 that are uninsured,
Hmm.
but who have less than 4 weeks of savings in their bank account. And if they're injured through no fault of their own, I mean, they stand almost no chance of receiving the same care that you and I do because somebody asks for a $10,000 deductible, that might as well have three zeros on it. It
Yeah.
might as well be talking about $10 million. It doesn't matter.
Right.
People can't just come up with that kind of money. And so there's a large uninsured population, but there's also a large underinsured population.
That is so, so true. You know, So now you have patients under financial pressure and providers under operational pressure. What happens to those who, those two, when they collide?
So currently, the system, and I don't want to be so negative, right? We
Hmm.
have the greatest research hospitals in the world. I
Exactly.
would absolutely, without exception, take our system over any others.
Right.
Those that call for single payer systems that replicate Canada or the UK, please be careful what you wish for, right? Because if you're in need of a procedure and the question that you're asking yourself is, am I going to live for the time that it's going to take for me to actually get that procedure,
Hmm.
right? That is a whole different level of stress that I wish upon no one.
Right.
So I want to share the positives as well. We have a fantastic system and research hospitals. We need to make it more efficient. We need to make care more available because, as you said, what happens when they collide are patients aren't receiving the necessary care because they can't access it or can't afford it. They're utilizing the emergency rooms when they shouldn't be. They should be utilizing urgent care. And so, what we need to do is stop this ongoing, encourage efficiencies, reward efficiencies in medical practices that are getting better. But for example, we all know that sometime soon, and it already exists today, robotic surgeries will be incredibly accurate and incredibly efficient, but they will also require tremendous capital investment,
Yes.
right? So let's encourage that investment. Let's benefit the healthcare providers willing to make those investments,
Hmm.
right? Rather than not wanting to. And
100%.
right, so 100% we need to encourage those innovations. And we need to really be pushing back. I have a larger conversation and piece that I believe in that won't be covered, I don't think, in this, podcast. And that is, I truly believe that our healthcare insurance companies should be treated more like utilities. They
Hmm.
should be making money, but they should be the ones that are regulated. They should be the ones that are forced to pay out dividends with their profits. They
Hmm.
should be the ones that are forced to reduce the administrative waste of back and forth. And they should be rewarded for increasing patient care, for increasing access, for decreasing denials,
Hmm.
not for increasing all of those to make more money.
Right. It's so true. We're also seeing changes in where care is delivered, like things like, ambulatory surgery centers and more, physician-controlled environments. Why is that happening?
It's all goes back to reimbursements. It is really ongoing declining reimbursements. So now you're losing money as a practice on your government business.
Yeah.
You are getting squeezed on your commercial business.
Hmm.
Your labor costs are rising, your real estate costs are rising, your equipment purchase costs are rising. So you are getting squeezed, right? What do? You find higher reimbursement. You do some things perhaps out of network where there's some higher reimbursement rates. You perhaps start to see workers' comp patients whose fee schedules sometimes are higher reimbursement rates. You perhaps consider seeing personal injury patients where, although the duration is longer, the reimbursements are ultimately higher. And you own your own surgery center. You go ahead as a partnership and a healthcare provider group. You license for different states have different licensing requirements,
Hmm.
and you build an ASC or an ambulatory surgery center, as you said before, so that you can have patients in your own facility and capture some of that margin that otherwise is going to a hospital.
Right.
Now, there's two things to say about that. One is I mentioned, not all patients should be seen in a hospital. It is a very high cost place to provide care,
Right.
right? So get the patients out, get the approvals going. The Total joint replacements, still in many states not approved in ASCs. They're just very slow at these approvals. And yet
Yeah.
outcomes have been, tremendous without the complexities of needing something in a hospital. So what I mean by that is take your high risk patients for whatever reason and keep them in the hospital.
Right.
And everybody, let's not try to pretend that everybody's a high risk patient just to keep business in a hospital. Let's get it to the most effective point of delivery possible. And that is more often than not an ASC that delivers cost of care for significantly less than
Hmm.
hospitals do.
Right. Very well said. So in simple terms, providers are just trying to regain control over how care is delivered, it seems.
I think there's a care delivery piece that they feel. I have those conversations far too often. They feel that insurance companies oftentimes, in essence, are dictating care
Hmm.
through denials. It's
Yeah.
not medically necessary.
Hmm.
Someone I know went to the hospital, thought they'd had a stroke. Hospital wanted to keep the patient overnight after ordering an MRI. Insurance company denied the overnight stay. Like, really? If a patient's walking in and a doctor and the staff is saying, we'd like to monitor you overnight, now what does the patient do? You're faced with a financial obligation. You've signed documentation that says if your insurance company doesn't pay, you will pay for this bill. And now
Right.
you're, how much does a overnight stay get me out of here? I'm not doing that. And what if that just puts you at risk?
Yeah.
I mean, that's a horrible place to be. So my point is, this is a situation with ASCs, as we were talking about, where you're looking to expand margin and increase reimbursements, not out of greed.
Right.
I watch these practices all the time. They are operating at thin margins. And also, let's talk about another possible solution.
Hmm.
Do we really believe that doctors should take 12 to sometimes 16 years, depending on levels of specialty and number of fellowships and all of those costs? Or could they possibly be equally educated, especially with technology enhancements that are going on today? Could they be equally educated at a lower cost in a shorter time period?
Right.
Right? That doesn't do anything for the doctors currently seeing us. Those are sunk costs that they had that they're now looking for higher reimbursements to
Hmm.
make worthwhile. But
Right.
can you imagine spending 12, 16 years of your life to prepare for something and then have insurance companies pulling the rug out by lowering reimbursements and making it almost not worth it?
Yeah. I see it happen all the time. It's terrible. It's terrible. So let me ask you a question. What does that mean for patients going forward?
So, patients going forward, I really would like to see a few things happen. So, first of all, I would like to see public pressure on healthcare insurance companies.
Hmm.
They kind of stay out of the limelight and the third party it's like it's the same with the third party liability carriers,
Yeah.
right? Flo, Gecko, Mayhem, whoever that deep voice dude is, Chris Paul and Aaron Rodgers and whoever else has taken a check from State Farm, all telling you that they will somehow be there in your time of need.
Yeah.
Stacey, you ever had an accident? You ever had a tree fall on your house and they come out and tell you how much they're going to pay you and you call a contractor and say it's going to cost 50% more than that? Where am I getting this job done?
Right.
Right? Insurance companies are constantly doing that. So I'd like to see, and the same thing with it's the equal translation with healthcare insurance companies,
Yeah.
right? Denying care that's recommended. I'm all for efficient care.
Hmm.
I'm all for efficient care. That's not the issue. Part of that is in the redundancies of information. Insurance companies are constantly asking you for more information. So too are doctors, right? We go to different practices. We go see our general physician. They ask
Hmm.
us to fill out paperwork and give us information. We go to our cardiologist, they ask for the same paperwork to be filled out and information. We go to the dentist and the same paperwork and information, right? All of this across the board, we have done, if we're younger, 20 times, and if we're older, 1,000 times.
Yeah.
Why isn't that available in a patient-centric ownership model where I have access to everything that has ever been done or tested or seen or operated on in one place for me? It is my information and I own it.
Right.
Stop telling me that a healthcare provider does, or it has to be done because, or you've heard you're redoing the same paperwork at the same physician's office. Oh, it's because they changed systems.
Hmm.
Like, not acceptable. That should all be patient centric.
Yes.
That's that would be a huge efficiency for both the healthcare insurance companies and the physician practice groups. But
Yeah.
it's a complete waste of time transcribing that paper information into fields within a new EMR, right?
Yes.
And patients need to own that. So I can very easily, in advance, call my physician's office and upload a link and choose what it is that I want from my entire history to share.
Right.
There may be things that I don't want to share for whatever reason, my call.
Hmm.
But have this be a patient-centric information ownership model going forward, not a physician practice, healthcare insurance. And then you see they make a tremendous amount of money, they being the healthcare insurance companies and the third-party liability carriers. They have to make money to stay alive. I get that. They have to make money to pay claims, but they do not need to be making the kind of money. It is much more for the good of our entire population that
Hmm.
they lower those premiums, increase their own efficiencies, move towards a patient-centric information model, and really try and clean up their side of the street.
Right. That's very, very true. Now, let's talk about the future. Like you're working at the intersection of healthcare and technology. Where can technology actually make this system better?
Yep. So at Gain, as you said, we're at the intersection of complex claims,
Hmm.
right? So these are litigated, subrogated, denied. These are personal injury claims. They're complex claims that doctors, physician practice groups would not normally know how to collect, and certainly not know how to collect at scale.
Right.
And so what we've done, and I'll just give the example that I believe is so applicable to so many areas and so many people's businesses, is we have implemented, starting in 2016-17, it was just predictive analytics. We
Hmm.
were looking for analyzing case values, improving risk management communications with medical practice groups, with attorneys, with case managers, with paralegals. And we automated a tremendous amount of that. And we built out a platform, and physician practice groups have EMRs, electronic medical record systems. Law firms have case management systems, right? So they're working in systems already. And what we did was we built out a platform that kind of connected all of that. And when
Right.
we did that and automated much of the communication, another thing, think about the document requests.
Yeah.
Send this information, give us that information, show us this MRI, give us that blood work, share with us. Or, by the way, we just redo it.
Hmm.
How many times have you seen or been asked to redo an MRI or an X-ray and then it's denied, but then it goes to another provider and it's approved? Like, it's a tremendous waste. And so my point is, with technology, our risk managers, as an example, 7 years ago, we measured all of this could handle about 200 or 450 cases at a time. And
Right.
today they handle 4,500. And that is not with less touch. It is
Hmm.
with much better automation, getting people information, documentation that they need timely. And
Yeah.
so for doctors, the utilization, the effective utilization of EMRs and the tying into all of your claims, whether those are government claims And there are revenue cycle management, companies across the board. Some are very good at government claims, some are very good at commercial claims, some are very good at workers' comp and complex claims. But really, really getting that dialed in to get leverage for your practice, save you money operationally, and increase your reimbursements. So
Mm-hmm.
we've seen tremendous efficiencies from the development of technology. And I also believe that going forward, you're seeing radiology and dentistry, for example, both making tremendous progress at analyzing by utilizing AI. It
Yes.
doesn't replace a doctor that's coming in to say hi, but it does get you a second, third, fourth, and 10 millionth opinion, right? As those things are run through large language models and cross-reference, they are having tremendous success. So I encourage healthcare providers and all of us to really continue to push the envelope, both on the treatment of those investment dollars, making sure that they are beneficial to you
Mm-hmm.
as a healthcare provider, continue to force the healthcare insurance companies to implement similar technology to eliminate administrative costs,
Mm-hmm.
and allow and encourage and incentivize medical practice groups to implement AI in terms of second, third, fourth, and umpteenth opinions, in terms of robotics and technology.
Very well said. Now, what's one way technology can make a patient's experience a lot easier? Because it seems like it's not really easy right now.
You just at this point, you have to continue to educate yourself to make it easier, because what is happening is you're going in, if it goes seamlessly, your deductible's been satisfied, you pay a copay, you see the doctor, the procedures are approved, you get better, you feel better, and life goes on. Like, that is the best case scenario, and everybody's happy. But what's happening now is you've got options, you want a second opinion, you take the time to do that. You've got to educate yourself. You have to be your own advocate.
Mm-hmm.
It is not easy right now. It requires effort. And please don't sit back and just do nothing but be frustrated. It is very frustrating. The first time that you receive a denial and you have to learn what the appeal process is, go through that appeal process. Get the doctor to write the opinion that says it's necessary and why, not just yours. Submit it timely. Make that phone call. See what they say, and be persistent. Many times it is denial that just leads to exhaustion,
Right.
right? Where we just give up. So I am sorry to say that actually requires us educating ourselves more, because that patient-centric model is not there yet. Reimbursements are declining, denials are increasing, right? Appeals
Mm-hmm.
thus are increasing. And you've got to educate yourself as to how to do that. You've got to find the doctors in your system that are able to see you and not go out a network to increase your own costs.
Right.
Right? Now, it's a little frustrating when you can't find a doctor, or you hope for a particular doctor and they're not in your system, but there are lots of highly qualified, wonderful doctors. So please don't assume that just because it's not the doctor that a friend or trusted family member recommended, that it's not going to be quality care. But you've got to do that. You have to find that. You have to seek that out. You may have to call two or three in order, because speed to service and convenience of location, right, is also a measurable that you would like satisfied.
Right.
But do that, and don't give up when something becomes frustrating and perhaps is denied. Make that appeal, file that appeal, ask the doctor for it, because receiving quality care and getting better is the most important thing. Sticking with a system and believing a denial is okay just out of exhaustion will get you nowhere.
Yes. 100%. Now, where do people overestimate technology and where does it actually help?
Right. So there's technology in theory right now, and there's technology in practice.
Mm-hmm.
So in theory, agentic agents will be doing so many things. We'll be scheduling patients and sending out reminders, and robots could be greeting patients and signing them in, and EMRs could be communicating with other specialists that need to then receive the information that a patient is providing, and all of that kind of seamless start to finish with, automation and robotics in theory is great. What we have today are wonderful, dedicated healthcare professionals who are meeting and greeting you. And what you should insist on, though, is insist on AI reviewing your medical records and the advice that the doctors are giving.
Right.
Most practices are not talking about it, but they have implemented or are testing or have been working with AI agents to review findings that they have. And they want to be right. They want to know if they've missed anything.
Mm-hmm.
They're not seeing you to be wrong. They're not seeing you to have something wrong happen or bad happen as a result of missing something.
Mm-hmm.
So the implementation of AI to review your records and the doctor's recommendations and see if there's anything missing should absolutely be insisted on. It exists today in many practices and should be utilized. So I talk about, and then again, the patient-centric information model in which we own all of our information and have access to it from the day that we're born until the day that we pass, doesn't exist.
Yeah.
So it requires more effort. And I know you were asking what makes our lives easier. I'm sharing with you some things that will make it easier, but will require effort in the interim.
Right.
And that is consolidate your medical records. When you get tests done, download them to the lab portal, download them to a healthcare provider portal, download them to a place. And so that you start to keep a centralized
Mm-hmm.
total record of your health.
Right.
Both
Oh,
those require more effort, but both will result in less effort and greater enjoyment going forward.
I agree 100% with you. Let's make this practical. Like for the person listening right now who feels overwhelmed by the healthcare system, what can they actually do to better navigate it?
Yeah. So review if you're insured and you're insured through a company. Utilize too many people sign up for something, receive it, and don't really ask the questions. If
Yeah.
you're working for a company that helps provide for healthcare, go with your HR department, go into your HR department and ask the questions that you need. Under what conditions does this deductible need to be satisfied? At what point does this kick in? Where are these networks? How do I access these doctors? Please walk me through this.
Yeah.
Right? So utilize your HR department at work. Don't be shy. Don't wait for something to happen when you then have the stress of something happening and you're not prepared and don't know how to navigate it. And you end up going to somebody that's out of network. It ends up costing you more money, etc.
Right.
So educate yourself about your health plan through your HR department if it comes through a company, which is a large percentage of businesses that do. If you're self-employed or if you work for a smaller business that doesn't have an HR department, but you've purchased healthcare on the healthcare insurance on the marketplace, do the same. Educate yourself about when deductibles come into play. Don't always look for the absolute cheapest per month cost.
Right.
Because the absolute cheapest now, if you're young enough and you're super healthy and you're really just buying what in essence is catastrophic insurance, that
Mm-hmm.
could be a very smart thing, right?
Yeah.
There's no reason to be overinsured if you fit that profile. So
Mm-hmm.
higher deductible, all of that's fine. You've never really used it. You're in excellent health. No problem. But for those with perhaps not perfect health or starting to worry about something or a little bit concerned, don't always look for that absolute cheapest dollar. Maybe for a few dollars more, your deductible is actually coming down pretty significantly.
Mm-hmm.
So pay attention to that. In terms of um, without the single information source of your records, as I said, consolidating it for yourself will make your life easy. But
Yeah.
I am not seeing, and ask your doctors, right? Talk to your doctors about as they're recommending care, about the likelihood of it being approved, about what would they be willing to, write a letter if it's denied, build some sort of rapport. So when you have to make that call to the office, you've already kind of talked about it in advance.
Right. Now, what is one mistake patients make that makes things harder?
If you're really making a mistake by not paying attention to the network that's provided if you have health insurance.
Hmm.
And it gets your out of pocket goes through the roof. Your out of network is a separate bucket. You're not satisfying your existing deductible. You haven't hit your benefits limit. It's just there are times that you want to go out of network and it's understandable, and you want to also come out of pocket for more money.
Hmm.
But it is a mistake to not know your healthcare insurance policy, to not know which doctors are in network versus out of network,
Hmm.
and cause, that kind of friction. That's denials just waiting to happen, and or much more expensive bills.
Right. Now, what's one simple action that gives people more control?
It's the consolidation of the information. You have much more control. It's going to take you time. I wish there was a product that I could point you to, or a company that I could point you to that's, consolidating all of that for you. There
Yeah.
are some companies that are starting to do that. Basically, they're just kind of storage areas for your information. You can do that at any one of your healthcare providers. They have given you a portal and portal access for the records that are theirs, right, from you visiting them, but you can load all of your stuff into something like that.
Right. Now, if we zoom out, what does all this mean for the future of healthcare?
We zoom out, we have to, I mean, we are just getting beaten. We as patients and citizens are just getting beaten by insurance companies with too much money, that can lobby with too much money, that can spend too much money on advertising to make themselves look better than they are. That is just, we're being outspent. And legislators, when they review that, and they're lobbied, and they're large donors, and like all of that influences, decisions.
Yeah, it's so true. What do you want people to understand about healthcare that they might not realize today?
The the absolute reason for the rise in premiums is a continued waste of money by healthcare insurance companies with astronomical and ridiculous administrative costs. Force them to get rid of it. Join an organization that pushes for that. Work on legislation that pushes for that. Put the pressure on the healthcare insurance companies to increase reimbursements for doctors, decrease your premiums, and eliminate or reduce significantly their administrative waste. That is the advertising dollars, the lobbying dollars that I'm talking about we are up against, and it is not pretty. They
Yeah,
paint a very pretty picture. They say they're doing all the right things, but we know as patients, we are not feeling that. We
yeah,
are feeling additional stress. We are seeing a doctor who is also feeling additional stress.
right.
The pressure has to be turned for patient-centric models with control of our own information, decreasing premiums, and increased reimbursements. Yes, that means we're going to squeeze healthcare insurance companies at both ends.
Hmm.
That is what that means. In order for me to receive lower premiums and you as a doctor to receive increased reimbursements, that means healthcare insurance lose twice. And they have plenty of money to lose twice, and they should stop spending money pretending that they are somehow doing something else other than maximizing profits.
So true. Now, can you tell us about your company and the services that you provide?
Sure, we are all about access to care. These are the 100 million Americans primarily with less than 4 weeks of savings who, if they are hurt through no fault of their own, stand almost no chance of receiving the same care that you and I do as an insured patient. And what we do is we have a nationwide group of 5,500 healthcare providers that are seeing patients on lien. In other words, we are able to either satisfy their deductibles financially for them,
Hmm.
or share doctor information for them to choose who to see, but with the knowledge that they could be seen on lien. In other words, without the requirement for upfront cash and without any obligation to repay if it doesn't come out of some settlement or judgment. So they
Right.
are not personally liable to reimburse for this care. And so in other words, we are the largest servicer of complex claims in the country. We're in all 50 states. We're at 20,000 law firms and 5,500 healthcare providers trying to make care available for those in need. That is primarily imaging, physical therapy, pain management, orthopedic practices, and the surgery centers in which they perform them. And we collect money for those doctors. We decrease write-offs by paying attention to those patients and those cases that are going on. We provide access to care for the patient or plaintiff, and we provide higher reimbursements for doctors and medical providers.
I love that. And what is your website address that they could find you on?
So it's gainservicing.com. And you can always email me directly. It's Reid, R-E-I-D, at gainservicing.com. I'd love to answer any questions. And if I can help or direct anybody with anything that they need, I'd be happy to.
And can you just give us maybe one or two takeaways that you want people to remember after listening to this episode?
Number one, advocate and educate yourself. Get all of your information. I apologize that it takes work and effort. Don't give up. When a denial comes through, appeal it. Talk to your doctors, get the information, submit it, and be persistent. You do not have to take no for that answer.
Yeah.
And number three, it's a fantastic healthcare system with wonderful doctors and dedicated nurses and practitioners all throughout the country wanting to help patients. We have the greatest research hospitals in the world, and it's a capitalist system that should survive. It just shouldn't be the only focus on the insurance side to maximize their profits when it should be for the benefits of patients and for the medical providers that have spent so many years educating themselves and becoming the experts that we ultimately trust with our health.
I love it. I love it. And you know what I appreciate about this conversation is that it brings clarity to something a lot of people feel but don't fully understand. Healthcare doesn't, feel harder for no reason. There's real pressures that happen behind the scenes affecting providers, patients, and the system as a whole. And when you understand that, you can actually start to start navigating it with more answers, more confidence, and more control. And you brought that to our attention today through your conversation. And I really do appreciate that because, your perspective, really connects all the dots together and helps make a complicated system a little bit more understandable, because most people don't find it very understandable because they're just not, well educated in that area because there's so much to learn and people get overwhelmed so easily.
Stay persistent, and let's try and find an organization that works on healthcare insurance companies becoming more like utilities to service you and I.
I agree so much. I thank you so much, Reid, for coming on the show today. I just love when you come on, and you just have such a big heart. And as you can when you're talking, it's not you're not doing this because it's a job, and it's not because it's your company. You're doing it because you care, and that's very evident in the way you speak and the compassion that holds in your voice. And I just want to thank you because me being a person with epilepsy and has gone through so much medical care and insurance problems, you hit home for a lot of the things that, you were saying. And I get it, I understand it, and I feel it. So having somebody like you on my side fighting for the cause means a lot to me. So from the bottom of my heart, thank you. Thank you for everything.
Thank you, Stacey.
You have a great day. Thank you for being here.